Hi guys, welcome everyone. My name is Madhavji Patatil here again for Sports to Science. Today we are going to be looking at kinetic chain and sports biomechanics. Okay, so what is kinetic chain? As you see here, we usually just think that our movement happen or the body chain is with muscle and the joint and the bone alone. But here we have to understand that joint as in two bones, muscles, and there is something called as fascia which connect to become a kinetic chain. So, kinetic chain is a system of interlinked body segments. Again, as we speak, joint, muscles, and fascia coordinating force and movement in sports. So, not just sports, even when walking or even when it comes to sports, other movements like throwing a ball, cricket batting, bowling. So, all of this are basically coordinated movements where a lot of force is produced. So, again, for all those actions creating high amount of force and power, it is created because of these different parts or segments like joints, muscles, fascia, and other joint capsules, etc. So, why does it matter? It enables, optimizes athletic efficiency, high performance, and injury prevention. As we speak, the amount of force that is produced by the body during these activities are very large or very huge. So, for that, we have to increase the efficiency. The body should work together. It should have a high performance. This is what separates the elite athletes from junior level athletes. How to use this whole kinetic chain together and injury prevention as we speak, because one joint or one part creating this big force would put a lot of stress on that one part, as in, for example, throwing a ball. If we just use our wrist or our elbows, it is going to be more tough to create the force. At the same time, it will create a lot of repetitive stress at that part. So this helps in injury prevention, at the same time optimizing, increasing efficiency and producing a better performance. So critical elements, like it involves muscular strength, joint flexibility, neuromuscular control, fascia, and precision and timing. So as we saw before, to create that good amount of force or an action, we need muscular strength. The muscle should be able to produce the strength first of all. Second way, joint flexibility. The full range of motion of that joint should be able to achieve. If you are trying to throw the ball, but if we are not able to lift the hand itself, there is a restriction in the joint. Obviously, it will reduce the force. Neuromuscular control, as we saw before, uh, all of these parts are controlled by the neuron. So we need a good neuromuscular control. Fascia, we'll see what fascia is later on, and also precising timings. All of this should happen at the perfect time to execute a movement. So the modern perspective, this contemporary research highlights transitivity, structural integrity through tension, fascia and neuromuscular contribution as core components. So this fascia, which is not known by many coaches or the athletes, is basically a small covering which is seen on top of the muscles, which runs throughout the body. Just like the skin, under that the fascia runs throughout the body, and there are different chains of fascia that are seen, which runs across, maybe runs through the side, in the posterior segment, in the very inner core close to the body next to the spine. So there are different kind of fascia that run across the body. So this modern perspective says that, like, the structural integrity, the strength of the fascia, at the same time the tension that the fascia causes. So we can think or see the fascia as like a string in a bow. The more we pull, the more force is produced. So that tension and that integrity of the fascia and the neurological contribution as we speak, because every movement happens because we are thinking about the movement and it should come in a flow. So the modern perspective talks about this and how this kinetic chain work together to produce movements or produce high force. So anatomy and biomechanics of the chain. So the core hub, the lumbopelvic hip complex, that is a central for load transferring between limbs. As we speak, the core part of us, what we speak as core, as abs, the lumbopelvic hip complex, the lumbar region, the ab muscles, the pelvis bone, and the hip muscles together become the lumbopelvic hip complex, which act like a transmission. It takes the load from the lower limb, bring it to the upper limb, or vice versa. Take from the upper limb and take it to the lower limb. So this core part is basically where the major transition happens. Sequencing. Movement starts proximally, core or hip, and progresses distally, hands or feet. as we saw before, think if I'm sitting here and trying to throw a ball. If I just do it like this, throw it like this, there is not much force that is produced. But if I bend back without using my legs, just bend back and try to throw, we will obviously cover more distance, throw more faster, and there will be more power produced to it. So, as we see there, the movement starts from the core, from the hip, the proximal part, and it is transmitted to the distal part. And also, one confusing thing that can happen is we think a lot of movement where, for example, we are doing boxing punches, all the forces produced from the ground. Yes, from the ground, the distal parts, it is taken to the core, but the final end movement is seen in the hand. That's why we say from the proximal, that is from the core, to the distal parts. Energy contribution. Lower limb and trunk provides 50 to 60% of energy for 5-speed throws and serves. So, as we saw before, as I was saying, like boxing, or let it be a badminton serve or a tennis serve or whatever it may be. So, what happens is the energy is produced from the ground with the ground support or from the legs. Because of the legs, the energy is created with the muscle tensing up, the fascia and the muscles tensing up in the limbs and the core, which helps produce the action in the upper body, and that is a 50 to 60%, more than half the amount of energy that is produced there. Then it is transmitted to the limb to produce a serve or a throw or anything in such cases. So myofascial role. Fascia link segments mechanically and provide sensory feedback. So two major important things is it provides a mechanical link, as we saw before, because muscles are connecting two parts of the bone. There are chances where the same fascia might connect two different muscles, which helps you produce the force. So this is seen everywhere, from lower body, from the calves to the thighs as in the quadriceps, or else going to the upper body and the core region. So this fascia helps in a very important role to connect these segments mechanically, at the same time provide a very important sensory feedback. So there are nerves which are connected to these myofascias, which again also act as a sensory feedback to understand how each and every single movement is happening. So it becomes an extra input for understanding where the body is. Something called as proprioception, where we understand where the body is and you can act accordingly, and it helps you bring out a better controlled movement for the best performance. Efficiency and performance. So you're going to see. So the optimal chain. So maximizing end segment speed, like hand or foot, and power. So this optimal chain, where from the lower body to the upper body, if the force is transmitting in an optimal way, what we see is a very good end segment, that is a hand or a feet power. For example, if I'm thinking you have a pelvic disalignment or a core muscle problem, or the core is not activated much, what happens is there is a missing link from how the force is produced from the lower limb, which is not being able to transmit to the upper limb because there is some problem with the core. So what happens at that time, the upper body will have to take a lot of load, which does not give good result. So this optimal chain is lost. So what we are saying is to make sure that for the activity that you need, if you're playing tennis or racket sport, you have to understand how to produce force from the lower limb and give it to the upper limb. Or if you're playing other sports like football also, there is always a limb that is used as support limb, and the other limb does the movement. So the force should be produced or should be transmitted from the support limb to the other limb. So you have to optimize the scene, make sure that the whole fascia, the joint and the muscles are at the optimal level. Let it be the tension or let it be the strength to produce that movement. Performance indicators. Greater lower limb or trunk power increases the higher velocity and higher throw and sprint velocities. As we saw before, if you have a greater lower limb coming from the femur part to the core part, if that power is higher or the strength is higher, there have been studies which says that the sprint velocity and throw velocity are also increased, because as we saw before, as I told before, the transmission happens in a better way. In tennis, something that you have to see is 54% of the serve energy originates from the legs or the trunk. So in the next slide, we'll see a picture where how the energy is transmitted. Same way with javelin, handball, and other major sports, lower limb function is very major in as an outcome driver. As you let's think for an example of baseball. You will see a person before throwing the baseball pitch. What happens is the person keeps the leg very far away. You see a turn in their legs, in their upper body, then it gets stuck, then they throw with their hand. So it is a well synchronized motion that happens from the lower limb and it is coming to the upper body. Load management, proper sequence protects joint from overuse. So again, let's go back to the same example of throwing a baseball, where if they are only using their upper body, just standing there and throwing, it will be a very repetitive, high force action that is happening in the upper body alone, which is not at all easy. So if you have proper range of motion, muscle strength, and proper movement of the joint in the most biomechanical way, what happens is the load is taken from the hand or the wrist or the elbow to the whole body. The whole body takes up the load, brings out a force together, and does the action. Let it be even if there is a valgus stress that is seen in the knee while squatting down. What happens is it reduces the force, at the same time creates a very big extra stress on the hip, which can cause an injury at the hip level if you are squatting down with knee valgus. Kinetic chain in tennis, as we saw before. So, as I told before, 54% of the whole force is generated from the legs, hips, and trunk and back. So, from the ground, the legs, hips, and trunk takes up 54% of the load. The shoulder has 21, elbow has 15, and wrist has 10%. So, from lower body to upper body, it is reducing. The amount of force that is produced is reducing. And as we see, 54% of the force is produced from the hip and the lower body. So the higher, or if a person starting from the young age learns and strengthens the core and hip and leg movements, at the same time learns how to integrate those two actions together, obviously the ball speed and the force production of the tennis serve will increase. So that's what an elite athlete has. When there are a lot of studies that were seen even in kickboxing or Muay Thai sports like that, and even in other sports like tennis, badminton, what they say is the difference that you see is the ability to use the lower body while using an upper body action, the ability to produce force, the strength, the range of motion, or the flexibility of the lower body joints, lower limbs, and the core joints. What happens is if you are able to use it better, there is better force outcomes and power outcomes that are seen in the upper body. Dysfunction and injury risk. So breakpoints. Weakness at a segment force other compensates, spiking injury odds. So as we saw before, if there is any kind of weakness in one little segment, let it be if there is a movement dysfunction seen in the thoracic level or even at a lumbar level of the spine, one segment has problem in causing the proper movement. What happens is the body starts compensating to do the action. The thing is that the body finds ways to do the action no matter what. If you have a problem, if you have a very bad leg pain, you still want to walk, you limp and walk. You try to reduce the force on that part where there is pain, and the other parts of the body will start taking more force or more hit and does the movement no matter what. So the same way, if there is any break point in the whole kinetic chain, the whole chain, just think like a bicycle chain, if one part is broken, instead of not being able to work, what it does is it tries to meet ends and does the action some way somehow. So what happens, the other parts of the body are taking more load, which can cause a very serious injury. So injury links. So 20% decrease in the core energy may increase shoulder internal demands by 34%, as we saw before. In any action which includes upper flexion movement or upper hand movements, what happens is if the core energy is reduced, the amount of energy that is reduced, which is transmitted from the lower body and the core to the upper body is reduced, shoulder rotational demands as increasing by 34%. So generally when we throw, we externally rotate, then comes an internal rotation comes to produce force anteriorly. So what happens is the rotational demand increases by 34%, which can easily cause injuries, because one day you might have some kind of injury to the core. You have a small strain in the core muscle region or lower limb muscle region. What happens is you won't be able to perform that easily that day. So what happens, your mind will be so hyped and motivated to do the action no matter what. So what happens, you stand there, you try to throw the ball even with the core strain. You won't The thing that you won't know is that your shoulder is taking up 34% as per the uh, article that we see. 34% is more uh, energy. It reuses more, it increases demand by 34%, which puts a lot of stress on the muscles and the joint of the shoulder, which can easily cause an injury. So the reduced hip range of motion equals more shoulder or elbow pathologies, especially in throwers, as we saw before. So if the hip range of motion is reduced, for example, a baseball pitcher keeps their leg wide apart, lunges way forward, and then does the movement. But if that range of motion is reduced to produce the same amount of force, what happens is there is more force that is taken up by the shoulder and elbow, which is seen a lot in other throwing movements as well. Imbalances in activity sequence, example soccer hamstring strain increases, is 8%. So the thing is that it is a sequence of movement that we see. Whatever we do, let it be running, let it be pitching, let it be doing an action, it is a sequence of movement which happens like a chain. That's why this kinetic chain is very important. So what happens is, if there is imbalance in activation sequences, for example, you're about to kick a football, what happens is you extend the leg and you kick. While extending, what happens is your core and glute should work together and activate. Then you should take then only the hamstring should activate for a perfect kick to happen. But if your body is not able to integrate this core and glute together, or if the gluteal insufficiency, which is seen highly in a lot of athletes, is there, what happens is there is an imbalance in the activation, and the hamstring is activated faster or before, and it takes up more load. So what happens, it increases the hamstring strain risk by 8%, not 8%, sorry, 8 times. So if it is 10% of normal risk, this problem or imbalance in the glute or the core can make it 80%. It's that much, 8 times higher risk in soccer, and while having a small imbalance in the activation sequence. So preventive strategies focus on flexibility, balance, and neuromuscular sequencing, as we told before. So flexibility, make sure that the whole body or the whole different joints which are there in the body should have the perfect flexibility and range of motion. The muscle should be able to allow the joint to move through the whole range of motion. And you have to make sure that there is balance also, because balance, think about all of these movement as soccer, kicking a football. What happens is you're standing on one leg, which requires balance. Again, pitching a ball for a brief amount of time, you're standing on one leg, then you keep the other leg, and there is a staggered stance that are seen, not if staggered stance, and even further longer stance. So in all of these things, there are different kind of balances involved. Let it be inline, or let it be two leg, or let it be single leg. When you're standing in all of these different positions, there are more amount of neurons that are activating to stabilize proprioceptive muscles, and the fascia is also activated. All of these things are activated and work together to produce the force. So you have to make sure that the balance of the body is there. Your body is not shaking, your body is not able to balance, the proprioception is not that good. So we have to make sure that all of this is also there to reduce the injury and make sure that movement happens perfectly. Neuromuscular sequencing, as we saw before, something that is very important is every movement which produces a high amount of force is a sequence or a chain of motion, like a very it should go like a flow. The movement should happen like a flow. So if that is not there, if the neuromuscular sequencing is not there, what happens is, again, there is a higher chance of injury. So you have to make sure that you learn the movement. You see, there is a way in which you learn every movement. You see it, then you make a neuromuscular image in the head, you try to activate the muscles, then you try to do the movement. So all of this should happen, and you should make sure that a very good neuromuscular connection and sequencing happens. You should try to visualize the movement. You should try to think what activates first, what are different joints, what are different muscles activate step by step to produce the end movement. So this helps, all of this flexibility, balance, and neuromuscular sequencing helps to produce the amount of force that is required, at the same time distributes the force along the chain, so that there is no overcompensation or compensation over compensation, or like improper load to any part of the body is there, so that uh, injury less high force movement is happening. Neuromuscular and sensory motor control. So neuromuscular pattern, precise learned activation of muscle ensure efficient energy transfer, as we saw before. A proper chain of movement, so that the action happens. Role of fascia. So the viscoelastic property enables both mechanical linkage and feedback sensing, as we saw before. So this fascia here is very important, so that it gives a very good proprioceptive feedback to the body, so that the body knows where the mind knows where the body is. For example, I'm closing my eyes, I'm taking my pointing finger, I have to touch my nose. It knows where exactly my nose is, and it can touch it. The reason for that is because my fascia and my body and the mind is aware where my hand and where my nose is. Same way, you're doing an action, you have to go through different phases like associative phase, learning phase, associative phase, and mastering the activity. What happens is, through this practice, your body learns what action happens first, where the body should be for the next action, and it continues and it produces the best action. So this fascia here helps you to understand, give a very good sensory feedback to create the movement. If the fascia is tight, for example, in such a case, what happens is, it reduces the range of motion of the muscles. Fascia is a covering over the muscle. Think, if the fascia is tight, I am pressing my skin down, I won't be able to see the muscle move itself. The muscle should contract. If it is contracting, it increases in size. If the fascia is tight, that increase in size does not happen. At the same time, the sensory feedback is also altered. So here, for the perfect neuromuscular pattern to happen, the sequence of action, like a flow of action, should happen. The fascia should be at the appropriate length. At the same time, you should do it so many times, you should practice it, you should master the skill, so that without opening your eyes or without thinking about it itself, you can do the action in a perfect sequence. Sensory motor integration, both body and the brain adaptation are vital, trained for coordination movement, not just for raw strength. As we saw before, we cannot stand here, I cannot stand here, throw a shuttle and hit it, and cannot produce 10% of my force, maybe not even that much. So not just the strength from my upper body, if I learn the whole movement, learn how to produce force from my legs, transfer it to my hip, how to bring the rotation movement and show it to my shoulder, it helps you increase a very like as we saw before, 50 to more than 50%, if I'm including my shoulder also, more than 50 to 70% of the force is produced from this part and not just the upper limb. So your body and the mind works together, puts a very proper sequence of neuromuscular connection. Every signal is sent from the brain to the different part of the body to do the action, contract the muscles, and make the action work. And you not just do the movement, also thinking about the movement helps you have a good sensory motor integration, senses and motor integration. Let it be efferent senses from the muscles also. This integration happens so that this very good adaptation is there to produce the movement. So it's just not about raw strength, it's about a flow of movement that helps you produce a good amount of force. Innovations, application, and conclusion in the last. So assessment, functional movement based analysis are now standard, following global movement patterns over isolated testing. As we saw before, to see a dysfunction in the hip, you do a whole squat, you see every single segment of the squat, how it is moving, to understand where the problem is. It's just not about the isolated part where you have to test to understand the problem. You have to test the whole body or the whole other joint segments to understand and uh, have a good functional movement based analysis to say where the problem is. So practitioners, let it be physicians, physiotherapists, or movement kinesiologists, and all those people should understand how this kinetic chain works or how this chain of action works, and understand the movement and analyze it. Take the body as a whole, not isolate the one part where the problem is, so that you will understand where the fault is, and you will be able to reduce the recurrent injuries that are happening because of that. Interventions: close kinetic chain exercises for stability. For example, you're doing a squat or a push up where the lower part, the legs or the hands, is fixed to the ground, and you're doing a movement other than those parts. So what happens is, here your stability will increase, the neuromuscular control, the signals, the firing from the fascia or the joint to the mind. It will increase the proprioception, which helps you increase the stability and balance. Myofascial releasing method, the neuromo- neuromotor drills for prehab and rehab. So what does that mean is, using foam rolling techniques, releasing techniques, or neuromotor drills where the neurons are used uh, or it is activated for prehab and rehab, before an injury intervention and all those things. It will help you increase the sensory from the fascia. At the same time, make sure that the fascia is in the optimal length. At the same time, it improves the neuromuscular connection or neuromotor unit connection, so that there is proper muscle action or intervention that is seen. Recent advances: digital motion analysis quantified segmental breakdown for fine-tuned interventions. There are a lot of different ways or camera-based technologies which are used to have additional digital motion analysis, or using newer biomechanical technologies, or let it be even IMUs that are used, so that you can see a very good synchronized movement, and there is a perfect quantified values for each segment and movement, which helps you have a better fine-tuned intervention. Key takeaway: kinetic chain is a multifactorial core stability, neuromuscular programming, and myofascial health thing. So first thing that you have to understand, kinetic chain is always multifactorial. It's just not dependent on one thing. It is dependent on the muscle, bone, joint, tissue, and the fascia. All of this combine to make a kinetic chain. It is not one thing. Or one more thing, neuromuscular part, neural part, where the neural activation at the same time senses sensory feedback from the muscles and the fascia is important to have a proper kinetic chain action. Core stability, something that you have to understand. The core is the proximal part from where the energy is transferred. Neuromuscular programming, every action or a sporting movement happens like a chain of movements. For example, you take a stance, you do a jump, then you do a smash for in badminton. Or while cricket bowling, you keep the back leg, then you keep the forward leg, then you take the body, then you move down to produce a force. Let it even be with throwing, other throwing actions. There are a chain of action that happens to produce a movement. So in that chain of action is controlled by the mind and the neuromuscular programming. So that is also improvement. Myofascial health are essential to make sure that there is proper length of each and every fascia, and also you have to make sure that there is proper muscular length also, so that it will help you help the movement to be proper and secure. Thank you so much, and that's it. I hope you all understood the kinetic chain and how it is important in sports biomechanics.